Get ready to invest in yourself and elevate your expertise with the Perio School podcast, brought to you by Perio School. It's Dr Reena here, and you're joining us for a new monthly show where we'll be providing the latest case studies, first-hand insights, and interviews with our global dental network. Plus, we'll enable you to experience exclusive behind-the-scenes highlights straight from our global portfolio of courses. Let's get started. This season of the podcast is sponsored by Kiroku, an AI assistant built specifically for dental professionals and one we've used for years. Kiroku listens to your appointments and turns chairside conversations into accurate clinical notes, referral letters, and treatment plans in minutes. What used to take hours now happens straight after the appointment. No late evenings catching up on notes. You can start a free trial at trykiroku.com. And if you'd like exclusive discounted access, email us at hello@perio.school. For today's masterclass, we're going to be talking about halitosis. And I have to say, it's a topic that I feel as undergrads we're not really taught about at all. And it's really common. We're going to be seeing so many patients with this condition, 1 in 3 patients. And I think it's actually an opportunity for us to impact someone's quality of life and actually make a difference and try and help them. So I thought I'd talk a little bit about halitosis. So if we start from the definition halitosis, it actually comes from the Latin for breath, which is halitus. And the Greek suffix osis means abnormal. So basically, as I'm sure you know, it's unpleasant or offensive breath odor independent of its origin. So basically, bad breath. But as I said, on a serious note, halitosis can have a major detrimental impact socially for the sufferer and can affect sort of normal social interactions. The true prevalence of halitosis, we don't actually know, but some reports suggest approximately 30% of people do have halitosis, so it's not uncommon. And it's really interesting when you look at the types of halitosis. There's intraoral halitosis, known as oral malodor, which basically describes cases where the halitosis lies from within the mouth. But there's also extraoral halitosis, which is where the source of the halitosis lies outside the mouth. And that can actually be further subdivided into blood-borne and non-blood-borne halitosis. There's also pseudohalitosis or halitophobia, and that describes patients who think or persist in believing they have halitosis even after professional assessment and diagnosis that they do not have halitosis. And I'm sure, I've come across a couple of patients like that, and they think they've got it, but actually they don't. And the final type of halitosis is temporary or transient halitosis, which is sort of, morning bad breath, or you've had some garlic to eat and you've got a bit of bad breath after that. So that's obviously transient. The one I think is most relevant to us is obviously intraoral halitosis. And the 2 most common causes of that is a tongue coating and periodontal disease. So whether it's gingivitis or periodontitis, or a combination of those. So it's important to know they're the 2 common causes, but of course there are other things that can make it worse. Conditions, for example, like herpetic gingivostomatitis or necrotizing gingivitis, or local factors like overhangs, caries, candidal infections, sometimes xerostomia as well is a big one. So I think the first thing is, if you've got a patient, make a diagnosis and figure out why they actually have halitosis. I think that's the key thing when you come to actually treating. When you look at the science, intraoral halitosis, it arises from the production of volatile malodorous compounds by the action of bacteria breaking down components of epithelial cells, salivary and serum proteins, and food debris. And a wide range of molecular species can contribute to the overall production of malodor. A lot of attention has been given to volatile sulfur compounds, and I'm sure you've heard of sort of methyl mercaptan, hydrogen sulfide, dimethyl sulfide. So they're all produced by those bacteria. The environment, I guess, that's related to us where this all happens, 2 places, the dorsum of the tongue. And if you imagine the tongue, I was looking at a close-up picture of the tongue the other day, and it's just crazy how many little, nooks and crannies there are, lots of little dips. When you look at it in close up, it's the perfect environment for the growth of these anaerobic bacteria. And that is where, this sort of thing is going to thrive. Also, the other place, as I'm sure you'll guess, is periodontal pockets. Great environment for anaerobic bacteria to eat all this protein and produce stuff that doesn't smell very nice. So there are key areas. But it's great in a way because those 2 are very easy to modify. So I think once you've diagnosed it, the main thing for halitosis is figuring out, okay, how can we help this patient? So I think key things, personalized advice is key. Obviously, oral hygiene is going to be imperative. So if we talk about tongue cleaning, I would say personally, every single patient should be cleaning their tongue. When you look at the surface area of a tongue, it's basically the size of an iPad mini, which is pretty large. And if you're not cleaning that in your mouth and you're cleaning everything else, it's going to make a difference. Possibly that could be the cause of the bad breath. If the debris builds up and you're not cleaning it, it's a bit like carpet. If you're not going to hoover it regularly, then it is going to smell. So home care in terms of tongue cleaning, and then also if they've got periodontal disease, good brushing, interdental cleaning, all of that is paramount to actually treating this condition. Of course, if they've got any type of periodontal disease, you're going to be treating that with supra and or sub PMPR. But I also think about chemical agents here. So mouth rinses have been shown to help with halitosis, or mouth sprays essentially. The key ingredients is chlorhexidine, cetylpyridinium chloride, and zinc combinations. They're the ones that actually evidence-based wise do make a difference to halitosis. And of course, from a dental point of view, if there are any local factors, we mentioned earlier, overhangs, caries, all of those things would also need to be addressed. So I think halitosis, it's one where you want to look at it holistically. It is a tricky area to bring up in terms of conversation, but I think as a health professional, it's our duty to make patients aware of it, but very quickly after explain how we can actually help them. And as a final tip, I think one thing that's helped with me, trying to reduce embarrassment for patient, I often just say to them, do you have a bad taste? And then they'll kind of, in conversation, bring in bad breath as well. So I think use it as an opportunity. And I think if you can help someone with it, it can make such a big difference to quality of life. So that's halitosis for you. And I hope you found it useful. We're thrilled to welcome Dr. Millie Morrison to the Perio School podcast. Millie is one of my good friends and also one of the most forward-thinking general dentists who now focuses just on ortho treatment. She's known for her holistic, patient-centered approach and her passion for interdisciplinary care, especially the perio-ortho interface. Her focus is clear aligner therapy and early interceptive treatment. And then alongside her clinical work, Millie is an international Invisalign speaker, an active board member of the BACD, and founder of the Aligner Confidence Program, which is a mentorship and education platform designed to help dentists deliver safe, predictable, and confidence-building aligner treatment. So, Millie, welcome to the podcast.
Hi, Reena.
Tell us a little bit more about your journey and we've known each other for many years now, but how did you get into ortho and focusing on that?
So, I'm a GDP, so general practitioner, and at uni, I really hated ortho and had lots of very positive feedback on my restorative skills.
Yep.
And so I sort of naturally came out, and I think, as many undergrads do, full of maybe slightly false confidence on how good my restorative skills were. But I really felt like that might be my path. And actually what happened is I was speaking to Depeche Palmer, and who some of you may know, and he was like, yeah, I just go to bed like looking at teeth and the anatomy and da-da-da-da, and I was like, blimey, I don't. And I really just was like, that was a really eye-opening moment for me in terms of where I saw my path going. And I was also working in a pretty high needs area, and the daily trudge was I found it quite challenging, and I actually almost left dentistry after this sort of, I won't go into it, but it was just this awful situation with this young girl. And so I knew I needed to change, and I was like, right, let me revisit ortho, because actually a lot of it really fits well with my personality.
Yes.
It's biology, it's physics,
yep.
it's problem solving. And so I came back to it, and I started off with fixed to begin with, and then moved to clear aligners, more so, and I got that buzz. I just absolutely loved it, and I wanted to learn more and more and more and more, and so I not fell into it, because it was an active decision, but I don't think I realised how much I would enjoy it.
Right.
And yeah, so slowly over the years, I have done less restorative, less general dentistry, and more ortho. And now I only do ortho treatment, which is
amazing.
And
yeah.
I love it.
Yeah, and I think it's nice that you kind of explored your options and then honed into then what. And I think you made a fair point. Like, you've got to enjoy what you're doing. I think
Absolutely.
if you're coming home every day and not happy and kind of worn away, like, that's not sustainable. So I think it's important, like you said, to take a check and see what you enjoy, and you can change your path as when you want.
Exactly. That's the great thing about dentistry.
It is.
Actually,
exactly.
You can change your path and you can get into different parts.
Yes, for sure. So we've been obviously working together for many, many years. We've seen so many amazing patients together and achieved so much. I've always found that you've definitely put perio at the forefront when it comes to ortho cases, and understanding the importance of periodontal health, understanding the kind of recession side. Has that always been important to you in terms of how did you get that knowledge? Because I feel sometimes it's not taught very well at undergrad level.
I actually feel that perio was taught really well when I was at undergrad. So
Maybe it's just
I was
me
really
then.
I was really blessed with very good tutors, actually. But also, I think it comes from obviously I come from a general dentistry background, so I feel like that feeds into it a lot.
For sure.
Perio and caries are the bread and butter of what we deal with most of the time. So actually, it's what we're seeing and treating. Also, I think most people can put their hands up and say that the first few of my cases did have recession at the end. And I think one of the most important character traits you can have is to be curious and actually reflecting and reviewing your cases. And I was curious. I was like, why is that happening?
Yes.
And so improved my knowledge that way,
right.
Versus being like, oh, that's happened, let me just ignore it, or being embarrassed, because actually if you're curious and you lean into it, then you get better, and you become a better practitioner. So for me, it's really important. And actually, when I think about patients that come and see me, some of them come to see me directly for ortho, some are general patients, but it's always health first, health first, health first, and I'll only move teeth if I've got a green tick from you, basically.
I think, and in the end, it works out better because when we've got that collaborative approach, the outcomes are better, patients are happier.
Yeah.
You're right. I've seen so many patients, especially recently, where they've had sometimes multiple rounds of ortho, then they have to come and see us for generalized recession, and we're having to do 5, big surgeries for them. And often they'll say to me, if I knew I would need this, I wouldn't have had the ortho in the first place. So I think you've got to plan really carefully to make sure that perio, otherwise medical legally as well. There's a big perio ortho is huge right now.
Absolutely, and working within individual biological limits is important. And also, being honest with patients. This is a skeletal issue. I can't solve this by just moving your teeth. If you want, if you think of a class 3 patient with a really small maxilla, bilateral crossbite, and they want a wider smile, if you haven't got the bone for me to work with that, then we can't do it.
Yeah.
That's a surgical. So you need to decide what you actually want, if it's surgery or if it's a compromise where we're sort of just aligning as best we can.
Yeah.
And I will find that those patients will go away and think about it and maybe come back in a few months' time. But I would much rather that than sort of jump in.
And you've done the right thing. One of the patients, I think one of my favorite patients we've treated together, Basra, a young girl, was one of the most, I think, from both the orthodontic side and the perio side, was one of the most extreme cases I think we've treated, probably one of the most satisfying cases. Just tell us a little bit more about sort of initially how that patient presented and what triggered the referral.
So she is one of my favorite people I've ever treated. She was so lovely, and she came in and she was working in a primary school, and she wanted to have Invisalign. She wanted to align her teeth, and when she came in, she had some pretty deep cavities. A couple of teeth needed root canal, and she had really severe perio. But her teeth were incredibly proclined. They were completely out of control of her upper lip. Her lower anterior teeth were crowded to a point where she could barely keep them clean. And so in that moment, I feel like I had a decision to make. So it was either a no, you can't have ortho, or a not yet. And actually, I went down the not yet pathway, because even though she had pretty low bone levels, they weren't awful. And I truly believe that it was an occlusal perio issue.
Yes.
And actually, perio treatment alone wouldn't solve it.
Correct.
And we were going to need to do some alignment at some stage.
Yes.
Because if we just did the perio, she would be part way there, but not the whole way there. And also from a confidence point of view, she is the person who's meant to be inspiring our children.
Yes.
And if she can't feel confident in herself, how can she inspire the next generation? So there was all that, looking at the person coming in with the teeth and not just the teeth. So we had that discussion of not yet. And she went to see Rory for some endo, and then she came to see you for some perio.
Yeah. So, I think it was one of the cases where I was thinking Millie's going to work her magic, but I don't know how. So we started off, she had severe pocketing. She had very significant bone loss. But I think, especially like with the new guidelines, you can, even with stage 4 cases, you can do ortho as long as you can control the perio, and you've got the person who's doing the ortho understands the importance of regular maintenance, picking up relapse. And I think we did the non-surgical, we did 2 rounds of sub-PMPR. We got her to a pretty good place. You started the ortho. I think we had a couple of bumps in terms of a little bit of her perio relapsed, but then we paused, we got it under control, then we continued. And I think it's so important to understand is once you've got the green light, you still have to monitor the perio. And if it does relapse, you've got to pause. You've got to get it under control, because otherwise, especially with a case like this, she could have ended up losing teeth in the process if we weren't careful.
Absolutely. And actually, that's why I like clear aligners for perio cases, because you can pause.
Exactly.
And the really nice thing is if they have had the perio treatment first, which they should have, then they tend to be really compliant, good patients, because their dental IQ has gone up so much.
Such a good point.
That they are like, oh, okay, no, I understand this. I know I need to wear this. I understand, what bone is around teeth. They understand where the teeth are. Like, they're just working at a different level with you. And so that teamwork with the patient works much better.
For sure.
So we did, I think we paused treatment once.
Yeah.
But I think she was under treatment with you for like 12 to 18 months before she came back and started the ortho.
Yeah.
So, it's not a quick
fix
solution.
No.
And I think you have to be really honest with your patients before, her gums, the buckle was like all and around her lower incisors was almost detached.
Yes.
It was completely, it was one of the worst perio cases I've seen. But with education between the two of us, she knew it wasn't going to be a quick fix. She came 18 months with you, then came to see me, and I think it was another 18 months.
Yeah.
Because we took a break in the middle.
Yeah.
And then she's on maintenance now.
Yeah. I think you made a really good point, actually, that they actually doing the perio first and getting them sorted, it makes them a better patient for the ortho. And also with her as well, I think once she was healthier, she felt better. She then enjoyed looking after herself. And then I guess the ortho it's just the icing on top, where now you actually look nicer with healthy gums, but you really made a significant difference to her quality of life and her confidence. She's like a different person when she came in.
And her upper anterior teeth are now under control of her lower lip.
Yes, exactly.
And you can tell that she's a much better patient. She got married, and she never asked me to take off her attachments.
Wow.
It didn't even occur to her that she should pause active treatment for her wedding day. And I was like, that's right.
Wow, I didn't know that actually.
Because she was so committed to the outcome.
That's amazing.
It was just part of the journey. And I was like, of course, I'll at least take off the anterior ones for your wedding photos. And you can put them straight back in.
Wow. And I think as well, like now people always push, obviously, ortho is great for aesthetics, but actually in her case, yes, she looks nicer. But I think now it's going to be so much easier to maintain her periodontal health. Yeah. She can clean more comfortably. There's less crowding. As you said, everything's more under control. That's such a good maintainable outcome for her in the long run. So I think sometimes the treatment, yes, it can take a little bit of time, but you're looking at her whole lifetime. And the stability. So and she's been really good with her maintenance. She's having regular 3 monthly maintenance, I think, is key. Are you always a fan of sort of fixed and removable retainers, or what's your kind of take on that? Do you have a preference, or
it will depend,
right?
on what they present with and
Okay.
sort of how treatment goes and oral hygiene and where what we are looking, what movements we're really doing, so where they started. And there's over the years different hierarchies have been produced so they can help you with your decision making. I think perio patients, if they've got low bone levels, then I would be more tempted to place one, but only if they are good with their maintenance. I will try and avoid them if possible. And sometimes I will even finish treatment and put them in temporary retainers and then just see for 6 months. Like, okay, so how is everything looking? Do I need, is the oral hygiene still on top form? Can you get away with this? Or do we need to just rely on the removable retainers more?
No, thanks for sharing that case. I think one of the key things from my side is you know, to say no to a patient, it can be quite disheartening. There's always often 99% of the time a way we can treat them, but you have to do it sensibly and carefully and safely, I think is the key thing.
Well, I think for Basra we only moved 4 to 4 in the end because I mean her upper centrals were pretty much horizontal. They were so proclined, they were so out of control, and so I was using the posterior teeth as anchorage to bring everything back, but we didn't need lots of movement posteriorly, so it was mainly tipping movement. So everything was sort of in our favour.
And teeth move quickly when they've had bone loss, so there are some advantages. I just want to finish by kind of touching on your Aligner Confidence Program. I think it's amazing. We've seen so many actually of our referrers have done the program. It's made such a big difference, clearly, to their confidence and the cases they're seeing. And what would be your top tip on someone, because obviously our listeners are not just periodontists, they are general dentists and hygienists in general practice. If someone is super interested in ortho but doesn't have the confidence, what would be your top tip for them in kind of taking that next step?
So obviously find a mentor.
I think that's,
But also taking it step by step.
And
really, if you're going to do something, immerse yourself in it and be really curious. So I feel like there is sometimes this reliance that whatever software you're using is going to do it for you, and therefore your clinical judgment isn't as important. But actually that's just false. We need to, even if we think about recession and perio, if we don't look at how far our teeth are expanding, especially those lower anterior teeth, they can be proclined and buccally moved, roots are going, through bone, no buccal plate left. Taking it step by step, making sure that you're choosing cases that you feel are suitable for you to take on, and making sure that you keep your value, you keep your control, and you make sure you prescribe where you want those teeth to move and have the confidence to say, this is where I want the teeth to move. How can we get there? Versus letting someone else dictate where the teeth are going to be moved to.
Makes sense. And I would highly recommend your program. It's all online. Seen it, people change through it. So thank you so much for taking the time. I know you're super busy, so I'm sure we'll see you again soon. But thank you, Millie.
Thank you.
Thank you very much, first of all. So this is our first session with our diploma delegates, dentists, and we would like to know whether there's something specific they're excited about this year, whether it's surgical, non-surgical treatment, whether any specific topics, or just overall, just meeting new people and hanging out with a lot of dentists in the group.
So hi guys, my name's Ed. I'm a dentist up in Manchester. I guess I'm just excited for everything. I'm a little bit older. I feel like I need to just brush up on all of my knowledge, make sure that I'm up to date with the basics, such as the diagnosis and treatment planning. And then, as the course goes on, I'm looking forward to making sure that my surgical techniques are as good as possible, so I can bring that to my patients and make my implant work a lot better than it currently is. So, really looking forward to it.
Fantastic. Thank you very much.
So I've been waiting for a long time to do this course, and I'm finally here, and I've been so excited about learning everything about perio. My aim is to specialise with a special interest in perio and learn as much as I can with regards to diagnosis, treatment planning surgically, non-surgically, and knowing how to maintain the patients post-treatment.
Thank you. That was great.
Hi, my name is Seema, and I really enjoy Perio. I have done my first hygienist course with Reena Wadia. It was in 2018, and after that, I gave overseas exam to become a dentist. And now I joined this course, and it's really very helpful to sharpen my skills. What I learned from her during hygienist course, it has now improved a lot as a dentist. So I would really highly recommend her to like everyone to just join the course. It's really worth to spend time on this course. Yeah, you will learn a lot.
Okay, welcome back to the Perio School podcast. Today, I'm joined by someone whose career sits at the intersection of clinical excellence, academia, and innovation. Dr. David Wu is a periodontist, educator, and researcher with an international career spanning leading institutions, including Harvard and McGill. He is known for his thoughtful approach to periodontology, his commitment to evidence-based care, and his passion for advancing the specialty. David, it's such a pleasure to have you on the Perio School podcast.
Pleasure to be here, Reena. Nice to see you, and thank you for the invitation.
Thank you. So, as you might know, this section of the podcast is all about behind the scenes, finding out what you get up to, and less so about the juicy perio side of things. So, I'll kick off with my first and probably my favorite question is what's your morning routine? How do you typically start your day?
Yeah, so to start the day, I usually get up at, I'm a morning person. I usually get up at 5 a.m. approximately. Depending on the summer or winter, I'll start the morning with a quick jog around the Charles River, right around sunrise time. So it's really
Very nice.
beautiful. Yeah. And then I'll spend about an hour reading a book, jotting down some ideas, sometimes replying to some emails to get the day started.
Amazing. Wow, that's probably one of the best morning routines I've heard on the podcast. Do you feel like that really sets you up for the day? Like, do you feel like it makes a big difference in terms of how you start your day?
Yeah, definitely. So I try to start the day always with some exercise and some reflection. It sets you off on the right course. Also, spending some time in the nature is great in the morning. You see sunrise. Sometimes it's in the forest, in the woods. So it's nice to have that to kickstart the day.
And then what does your breakfast usually look like in terms of, because as you know, your days must be jam-packed, you've got to be on point all the time. Is there a certain meal that you always have in the morning to get you going?
My meal is quite simple in the morning, actually. I start with a cup of espresso, either Italian or Viennese coffee,
Right.
and I'll have a glass of green tea and usually an egg and an avocado. So very simple breakfast.
Nice. I get, and it's the same every day.
Very similar every day. Sometimes I'll have one piece of whole grain wheat toast. And,
Yep.
very simple.
Nice. So, three things we can always find in your work bag. So, three things that you just can't live without that you always need for your day to day.
So three things. I'll always have a pen,
Yeah.
and I always use the same pen. So it's an interesting story
Right.
where when I graduated from residency in grad school, one of my co-residents, he had gifted me this one pen, and he mentioned, "Hey, David, use it well. Use it to sign important things." So I think I took it to heart, and I actually write everything with that specific pen. So I'll change the cartridges, but I'll keep that one pen.
Oh,
And
that's so lovely. And it reminds you of the time when he told you that, and it's hopefully a pen you can use for many, many more years.
exactly. And the second item I'll have is always my laptop, and the third item is a notebook. So in
Nice.
the age of AI,
Yes.
everybody is taking notes with artificial intelligence apps and transcribing. But for many of my meetings and to brainstorm, I actually like to use analog. So I'll use a notebook to jot down simple ideas. You can draw diagrams, and it combines really well with the current technologies.
Fantastic. So your day to day, you're balancing your clinical practice, your research, your teaching. It can be quite an intense day. Do you have a typical day, or is every day different, or what's the kind of structure of your day to day?
Yeah, so in a week, I try to compartmentalize between these three pillars. So on some days, it would be my designated teaching education day, So be starting off the morning, 7:30, 8 o'clock in the clinic, working with residents and students. And then I'll have some meetings from noon to 1. Usually afternoon will be administration, so some committee meetings, meeting with students, finishing off from 5 to 7 with a seminar. So we have a treatment planning seminar all 3 years in the Perio program, discuss about cases, preparing residents for more advanced treatment. So that's kind of like how a teaching day is. For research, it's more thinking. Also, have protected time to maybe read a manuscript, read a grant, some time to meet with individual students and grad students at the lab to discuss about a project, how things are going, read some articles to be really up to date, whether it's clinical research or a basic science materials type of research. And for clinical day, I'll have 1 day per week where I'm seeing patients. And those days I start usually 7:30 to 8. I'll be at the practice preparing for the patients for the day, reviewing CBCT scan, planning for the surgeries. And I usually finish around 6 p.m. So that's my clinical day. So I try to every week will be a combination of those three elements. It's quite a nice change of pace and activates different part of your brain.
Is there any one particular day that you enjoy the most, or is it that combination that you really like?
I really think it's a combination that I enjoy. Having the opportunity to teach and mentor students, taking ideas from the clinical practice and then sharing it with the students. So sometimes it will be doing a very interesting surgery or case, and I'll bring it to my morning meeting with some of the residents and students I'm mentoring to highlight, okay, this is a concept we discussed about in class last week. Now this is how it's done in practice. And it generates many ideas for research as well, whether it is unmet clinical needs or technologies that we want to bring from the lab to clinic, and thinking about strategic ways to bridge basic science discoveries to clinical practice through innovation.
That's brilliant. So they all work in synergy and kind of feed each other, and amazing.
Yeah.
So you have achieved so much today. It is so inspiring, and especially for our listeners who have an interest in perio, and even if they don't, like the amount of things you achieve, even on a weekly basis, it's just incredible. I mean, if you had to pick a career highlight so far, I know it must be really tricky, but what would be your career highlight?
Yeah, I think right now the most important career highlight is actually starting my research group. So this is fantastic opportunity because it brings together all three pillars. So one being mentorship and teaching the next generation, not only as a surgeon and as a periodontist, but also as a scientist, thinking about creative ways you can impact human health, you can impact the world, whether it is through clinical research or it is through clinical trials. There's many different things that the students can do, and they do come up with really interesting and unique ideas to bring into reality. At the same time, it also keeps you, engaged with the clinician community, going to conferences, really building out those ideas into new technologies that's going to create value in clinical practice.
Right.
So this would be the biggest career highlight or milestone, starting my own research team.
Fantastic. No, we'll be following that very closely. And in terms of keeping yourself motivated, because every day, as you said, you've got those three pillars that you are working through. Every day is quite involved, and to come up with those fresh ideas and innovative ideas, you have to stay motivated. You have to stay inspired. What keeps you going? What keeps you motivated through the week?
What keeps me motivated is really that bigger sense of purpose and the long-term vision for the work that I am doing and that we are doing as a team. It's really comes down to a couple of things. First is really developing the next generation of clinicians, of scientists, of educators, of people that can impact our field. And really, the energy working with our students, residents, research fellows is palpable because they are the reason why we are in this role. So that really motivates you. And seeing former students now graduating to become specialists, and they're in very successful practices, they're starting their own research teams, they're venturing into business as well, purchasing several practices and becoming leaders. I think seeing that as an outcome is really motivating. So when a day gets quite busy, or it's a long day, you think about the broader impact you can have on the field, as well as on your patients too, right?
Yes.
Being clinicians, we're impacting patients, more of an immediate impact,
Right.
shorter term gratification. And when you're seeing students having these decade-long careers,
Yes.
being successful, that's long-term or delayed gratification. So it's also shifting the concept of neurotransmitters, right? When you're having
Right. Yes.
immediate gratification, it's more dopamine.
Yes.
And when you're going towards more nurturing, more building with the students, with people that you mentor, you're transitioning to a serotonin or oxytocin. So that kind of keeps you, in terms of neurotransmitters,
Yes.
motivated as well.
I love that. Absolutely brilliant. What's the biggest myth about periodontology that you would like to challenge?
Yeah, I think it isn't necessarily a myth. It's interest in the specialty. Oftentimes thinking about periodontists as, okay, we're doing these fantastic, plastic surgery procedures or implant procedures. So we tend to think of dentists as a procedure-driven profession. Now, what I like to challenge every single listener in the audience is to think about us as really healthcare providers, physicians, and thinking about, personalized medicine, 4P medicine, right? Preventative medicine, personalized medicine, adapted to each individual patient. So I think shifting our role on a procedural based reactive profession or specialty and changing it to a more preventative, personalized, with coaching, education, teaching, and then shifting how the practice model is based around.
Yes.
I think that could be very powerful.
Yeah. And I think people are starting to realize the importance of that and the importance of holistic care. And we are a part of medicine at the end of the day. So, yeah, for sure. Now, technology, you mentioned, AI, there's so much technology nowadays. Is there a specific tool that you use that has changed your workflow or improved your workflow?
Yeah, absolutely. So I integrate AI in my daily routine, every day, from note taking for a meeting, brainstorming. So there's certain apps you can use for that. For researching information, so let's say, okay, we are thinking about this new publication in this field. Now, what is the current literature? There's so much information out there. So AI can help you perform that initial research, organize your thought into a structured way of thinking, and that can certainly help as well. When it comes to patient care, now there's several companies and startups that are starting to utilize AI for all sorts of diagnostics purposes, from identifying pathologies on intraoral radiographs to looking at design of surgical guide and implant planning. So there's AI basically integrated in every aspect of our professional and practice spheres. So I think it's important for us to really learn AI.
Embrace it.
And I think AI is thinking about internet back in the late 1990s, early 2000s. I think AI is internet 3.0, right? It's going to be involved in every aspect of our lives, our patients' lives. So it can make a practice and a team much more effective.
Yeah, for sure. I think exactly. It just improves the efficiency rather than taking over our roles. It just improves the way we work. So completely agree. Everyone should be embracing it. What's your favorite quote, or is there a principle that you tend to live by day to day?
A principle that I actually live by day to day is the KISS principle. Keep it simple.
Yes.
Everything can be diluted down to a couple of key principles, and thinking about explaining a complex disease process to the patients. If you keep it really simple and adapt it to each person that's sitting in your chair, you're connecting and forming these very unique relationships and tailoring your philosophy and treatment to the individual. Same thing when you're teaching or working on a research project, right? Oftentimes, keeping it simple is a straightforward path to success.
For sure. I couldn't agree more with that one. Now looking back, all these years that you've gone through dental school, specialist training, now teaching, and developing the next generation leaders. Looking back to your younger self now, what's a key piece of advice that you would now say to yourself?
That's a fantastic question. I think looking at my younger self, and this is a message that I share with many of our DMD students and
Right.
graduate students, is really to stay open minded in terms of willing to accept new ideas, and also open-mindedness in terms of learning something, even though you think your career path may not be directly related to that, but you're going
Right.
to learn it later. One of my mentors used to share with me, David, everything that you think you will not need and you don't want to learn when you're given the opportunity, somewhat, somehow in life, you will end up needing to learn that concept again in the future. And he gave me the example of microbiology. So
Right.
he wanted to become a periodontist, really focusing on the tissue engineering stem cell aspect of things, and thought, okay, I don't need to understand microbiology as much. And his PhD dissertation ended up being on microbiology.
Oh, wow.
So that's what I share with our students. Some students, they want to become oromaxillofacial surgeons or periodontists. I think, okay, I don't need to learn how to make a prosthesis or denture. Oh, I don't need to learn how to make a
Yeah.
crown really well. But when
Yeah.
we're looking at these advanced reconstructive cases, knowledge of prosthodontics, occlusion, orthodontics, everything really comes together
Yes.
when we are treating the patient, right? It isn't about being a master of one surgical procedure. It's about understanding and how to provide quality treatment for your patients and working teams and
For
communicating.
sure.
Yeah.
For sure. I mean, yeah, keeping an open mind, and I guess also you don't know what you don't know. So until you learn about it and think, okay, now you can connect the dots, and as you said, it can benefit you in the future for sure. Um, Now as well, like linked to that, has your definition of success changed? Because as we all know, when we're young in our career, we have a certain vision of what we think is successful. But now, many years on, has your definition changed?
Yeah, that's a fantastic question. My definition of success has definitely changed. Starting in dental school, you see success as in maybe one day you become a specialist, you have a stable career, you may be owner of a successful practice, and you teach half a day a week, and
Hmm.
you know you're able to lecture on the podium. So that was the definition of success. I think how that evolved is you think less about yourself, but more about how you can impact others, and how you can impact others maybe uh, both at an individual level, but also at a societal level. What are our contributions, and what kind of change we can positively, foster? So, what I think more about now, what makes me happiest is when my students are successful. They
Yes.
did their first procedure of any kind.
Mhm.
It has amazing healing outcome, and that level of excitement really encourages me. And also, we have other students working on research. They published their first scientific article, and they're
Yeah.
really excited, and they tell me, hey, Dr. Wu, I think I'm going to pursue a career in that path as well. So I think that motivates me more so than personal successes in terms of awards or publications or any type of metrics. Yeah.
That's really lovely to hear, and I think it's nice when you're inspiring them, you're inspired by the students. It's just a really lovely kind of ecosystem for motivation. I have a strange question. If you weren't in dentistry, which is sometimes when we're in dentistry, it's all we can think about.
Mhm.
If that wasn't your career path, what do you think you'd be doing instead?
That's a great question. And I think I'm very fortunate because I am a dentist, a clinician. I'm also in research as a scientist. And if I weren't in dentistry, I'd probably be in biotechnology, building life-saving treatment, therapeutics, material
Yeah.
systems to help patients, and sharing that knowledge by teaching. So, yeah.
Nice. And my final question, so looking ahead, we've talked about all the technology and all of that coming along on the scene, but is there anything else that excites you about the future of periodontology?
I think what excites me about the future the most is how we integrate all these innovations in technologies and really build care models that are much more integrated. So thinking about, you're based in the UK, and there's the NIH system.
Yeah.
That system, right? There's the different hospitals. So thinking about ways to better integrate data from hospitals to private practices, and everything is linked through AI, through a cloud. Access to data is going to be much easier. Patient education based on their health conditions is integrated. Thinking about different types of precision medicine, cellular diagnostics, using AI to look at radiographs, so we can generate these reports and these health reports and health scores for your patients. So you're, in the future, maybe when your patients are coming to your office, instead of thinking, okay, I'm going to go see my dentist for a restoration and a cleaning, oh, I'm going to my dentist for a wellness check where I get my microbiome score, my overall metabolics in the oral cavity score. How can I improve my life, my nutrition, my exercise, as well as my stress prevention, stress mitigation, in order to be healthier, rather than going there for a particular procedure. I think if we're able to find creative ways to shift the practice of dentistry really into oral health care, that will make a difference in terms of public perception, and also trust in the whole profession.
Yeah, I mean, what an amazing time to be in periodontology, in the dental profession, and lots of exciting things to come. David, thank you so much for such an inspiring conversation. I know you're super busy, so thanks for giving up your time, and I'm sure our listeners will enjoy the conversation as much as I did. Thank you so much.
Thank you. It's a pleasure to be here, and I'll talk to you soon.
Thank you. This season of the podcast is sponsored by Kiroku, an AI assistant built specifically for dental professionals and one we've used for years. Kiroku listens to your appointments and turns chairside conversations into accurate clinical notes, referral letters, and treatment plans in minutes. What used to take hours now happens straight after the appointment. No late evenings catching up on notes. You can start a free trial at trykiroku.com. And if you'd like exclusive discounted access, email us at hello@perio.school.